Most people don't know that this facility was originally a Holiday Inn back in 1960s, built originally for the World Fair, which didn't happen in Oklahoma City. It got moved to San Antonio. So it's remained a Holiday Inn for a period of time and then was bought by Health South and converted into a rehabilitation hospital and a work hardening station. So in 2004, Valir purchased a facility from Health South. To talk about the services we're going to add, I probably should describe the services that we perform. And so we have a rehabilitation hospital that includes treatment, post-acute care for brain injury, and then also stroke patients, spinal cord, and then sophisticated orthopedic type injuries. We also have a hospice division that works out of here, and then we also run our physical therapy outpatient clinics, which there are 15 scattered around the state from this facility. What we also have added recently is a PACE program. It's the second one in the state, which stands for Program All-Inclusive Care for the Elderly. And that is a recognized need in the marketplace for basically the poor elderly that are absent of healthcare needs, people to meet those needs. And a PACE is a Medicare, Medicaid type program that we've invested in, put in place, and now have about 80 participants in that program. So all of those businesses are being run out of this campus. What we are adding as complementary services is a wound care clinic on the first floor, radiology lab, pain management center. We have also embarked on what we've identified a need in the Oklahoma marketplace as a drug rehabilitation center that will be part of on the third floor. We're starting with an all-female facility. We've already acquired through Vizone, a sister company, a all-female residential program out in Pink, Oklahoma. So it'll be a continuum of care for drug rehab. We've also started a transportation division as a need of transporting participants from the hospital back and forth to acute care facilities, nursing homes, and also for our PACE participants. Well, to keep up with the marketplace and also just to be on the higher end of taking care of our patients, what we have embarked on is a total renovation of this campus. We've already renovated the PACE facility so that we could bring the PACE participants in there. But on this campus, second and fourth floor where the hospital is located, we're renovating the rooms. And we're standing in one of the renovated rooms right now. They were circa 80s, 90s in the past, and now we're bringing them really to a high standard with custom woodwork, with custom tile, custom granite, places for patients, families to sleep that you're not going to find in other types of locations. These rooms are, because it was a Holiday Inn, these rooms are a standard size, 330 square feet. Most hospital rooms aren't quite that size. And plus we have good windows space and light coming in, which has a healing effect in itself. So we're happy to get the renovations done. We are about halfway finished. The second floor will be finished this week. Then the fourth floor will be finished by the end of the year. As part of the outside construction, which will lead into some more inside construction that we need to have done, the north expansion that we're going to do right outside the north side on the porte cochere is basically a 4-story building which will house gymnasiums on the second and fourth floor, rehab gyms. The third floor will be an extension of the drug rehab, what we call the ARC, or the Addiction Recovery Center. And then on the first floor is we are adding, as I said before, the wound care center. The expansion will include a new radiology center and then other professional services that we'll need there. As part of moving the gyms to the second and fourth floor, I get to vacate the gym that is now on the ground floor unclog the elevators, and then build the new dining room where the current big gym is. That will allow me then, we will refurbish the kitchen and the dining room area, so we'll have a good experience for all the guests, for people who just want to come in and have good food and good service. And then we will convert the existing dining room facility into new pharmacy services, both wholesale and retail.